Good evening, wherever you are. This is Alina Park from ConferenceHype. Our segment will focus on systemic treatment followed by radical resection, combined with intestinal autotransplantation for locally advanced pancreatic cancer, a retrospectively observational and prospectively validated study. From the 2026 August 6 edition of Annals of Surgery. Background: the development and reliability testing of a video-based competency assessment tool for magnetic sphincter augmentation of the esophagus. Methods: 10 international experts in anti-reflux surgery participated in a 3-round virtual Delphi consensus process to develop the MSA-CAT. Results: operative steps and key errors were drafted based on the literature. Discussion: this work describes the development and reliability of the novel MSA-CAT. From the 2026 August 1 edition of Annals of Surgery. Background: vascular pancreatic surgery is increasingly performed for locally advanced pancreatic neoplasms. Methods: patients who underwent elective pancreatic resections with mesoportal venous interposition grafts between 2003 and 2022 were identified from the Institutional Pancreatectomy Registry. Results: in this study, 201 patients with venous interposition grafts were included. Discussion: alloplastic venous vascular grafts are safe and readily available tools in pancreatic surgery, especially for long segmental mesoportal venous reconstructions. From the 2026 August 1 edition of Annals of Surgery. Background: severe acute pancreatitis affects 20% of patients with AP and is associated with high mortality rates. Methods: we analyzed data from a prospective database of patients with AP admitted to Vall d'Hebron Hospital from November 2015 to January 2022. Results: out of 634 cases, 594 were analyzed. Discussion: the ML models showed good predictive capacity for SAP, ICU admission, and mortality using early-stage data without laboratory or imaging tests. From the 2026 August 1 edition of Annals of Surgery. Background: PANNETs uncommonly present as cystic lesions. Methods: clinicopathologic data of patients with resected PANNETs were collected from 4 high-volume centers between 2000 and 2019. Results: of the 1727 patients undergoing pancreatectomy for PANNET, the median age was 58.1 years, and 53.3% were males. Discussion: cystic PANNETs have a more benign course than their solid counterparts, and conservative management can be considered for endoscopic ultrasound-guided fine needle, aspiration-proven cystic PANNETs less or equal to 3 cm. From the 2026 August 6 edition of Annals of Surgery. Background: obesity is associated with immune dysfunction that supports lung cancer progression, namely reduced cytotoxic T-cell activity and expansion of suppressor populations. Methods: obese and lean mice were implanted with Lewis lung carcinomas under sedentary conditions or with exercise wheel access. Results: obese mice allowed voluntary exercise displayed less profound enhancement of TREGs and potentially suppressive myeloid cells and fewer CD8 plus T-cell deficits in the tumor and lung. Discussion: exercise may reverse adiposity-associated immune suppression in the lung and tumor microenvironments, to complement lung cancer interception and treatment strategies. From the 2026 August 1 edition of Annals of Surgery. Background: the prognostic implications of the technical aspects of CRLM have not been well characterized. Methods: a prospective database of 1776 patients who underwent complete resection for CRLM at a single institution was studied. Results: margin status was independently associated with an initially isolated liver recurrence hazard ratio for positive 1.199 versus greater or equal to 10 margin, 2.21, 1.42, 1.41, p equals 0.001. Discussion: pathologic margin after resection of CRLM is associated with higher rates of overall recurrence that are less amenable to salvage and not just local failure. From the 2026 August 6 edition of Annals of Surgery. Background: evaluating the impact of cognitive load on surgical performance is crucial for training and patient safety. Methods: 20 novice surgeons performed a suturing task under 3 conditions: self-paced, time-pressured, and time and cognitive stress. Results: subjective cognitive load increased significantly with task complexity, while suturing performance declined. Discussion: the DLPFC supports planning and attention, the frontal PFC multitasking, and PMC SMA motor preparation. ConferenceHype is interactive AI commentary only. It is not reporting, journalism, medical education, clinical guidance, scientific validation, legal advice, or financial advice. ConferenceHype is independent and is not affiliated with conference organizers, presenters, sponsors, or exhibitors. From the 2026 August 6 edition of Annals of Surgery. Background and AIMS. Robotic liver transplantation represents the latest evolution in solid organ transplantation. Methods: this retrospective multicenter cohort study included consecutive patients undergoing whole graft RLT at 2 European centers between February 2024 and October 2025. Results: 45 patients met inclusion criteria. 1 was excluded due to conversion before robotic docking, yielding a final cohort of 44 patients. Discussion: robotic whole graft liver transplantation achieved benchmark-level outcomes for major perioperative and early post-transplant parameters. From the 2026 August 1 edition of Annals of Surgery. Background: PDAC response to NAT is measured with biochemical, radiographic, and pathologic parameters, which can often be discordant with each other. Methods: patients with PDAC undergoing resection after NAT at a single institution were retrospectively analyzed. Results: from 2011 to 2022, 225 patients underwent pancreatectomy after NAT. Discussion: CA19-9 response to NAT alone is not enough to identify long-term post-resection PDAC survivors. From the 2026 August 6 edition of Annals of Surgery. Background: PHPT was associated with increased cardiovascular morbidity and mortality. Methods: the electronic health database encompassing the entire public health system in Hong Kong from 2006 to 2023 was used to emulate a randomized controlled trial. Results: among 6898 PHPT patients identified, 1959 underwent parathyroidectomy. Discussion: Parathyroidectomy reduced the risk of MACE in patients with PHPT. From the 2026 August 1 edition of Annals of Surgery. Background: the risk of developing CRC varies depends on the expression of mismatch repair proteins. Methods: in this retrospective study, we included a Danish cohort of patients who underwent surgery for CRC between 2009 and 2020. Results: a total of 3,625 patients with localized deficient mismatch repair CRC were included in the study. Discussion: in patients with localized deficient mismatch repair CRC who underwent surgery, a significant association was found between loss of MSH2, MSH6 versus loss of MLH1 PMS2 expression and OS. That's it for now for ConferenceHype's coverage of the August 2026 issue of Annals of Surgery. If anything was missed, tell us which article deserves follow-up. Tag us on X. Add your perspective in the comments, share this review with your clinical team, like the video, and subscribe with notifications turned on for the next journal broadcast.